For decades, orthopedic surgeons around the world have watched the same quiet tragedy unfold. A patient walks in at 76, 78, maybe 81. They're still moving, still functional, still proud of the fact that they walk every single day. And their doctor smiles and says, "Keep it up. Walking is great." So they do. They walk, and they walk, and they walk. And then one morning, they reach for something on a low shelf and feel their knee buckle. Or they step off a curb wrong, and suddenly they're grabbing at the air. Or they go to stand up from the dinner table and realize, with a cold, quiet shock, that it took them 3 tries to get up. Nobody warned them this was coming. Nobody told them that walking, as wonderful as it is, was never going to be enough to protect them from this. I'm Dr. Sophia, and this channel, Wellness by Dr. Sophia, exists for moments exactly like that one. Not to frighten you, not to overwhelm you, but to sit with you, the way a trusted physician sits with a patient and say, there is something better you can do. There is something specific, something proven, something that takes less than 15 minutes a day, and it will change the quality of your life more than any other single decision you make this year. So if you are over 75, or if you love someone who is, I need you to watch this entire video. Because what I'm about to share with you is not a fitness trend. It is not a YouTube workout routine. It is a medically grounded answer to the question that orthopedic surgeons have quietly been asking for years, and that most people over 75 have never been told the answer to. Let's start with the truth about walking, because I want to be very clear before we go any further. Walking is good. Walking improves circulation. It supports heart health. It benefits mood, lung function, and joint mobility. If you are walking every day at your age, you deserve credit for that. Most people aren't, and I am not here to take that away from you. But I am here to tell you that after 75, walking alone is functionally incomplete. And that gap, that quiet gap between what walking does for your body and what your body actually needs, is where falls happen. It is where independence is lost. It is where the slow erosion of strength and stability begins. Not dramatically, not all at once, but steadily, invisibly, until one day the body can no longer catch itself. Here is why. When you walk on a flat surface, which is how most people over 75 walk, you are primarily moving forward. You are using a fairly narrow range of muscle activation. You are not significantly loading your quadriceps through full range of motion. You are not training the lateral stability muscles around your hips. You are not challenging your proprioceptive system, the network of sensors in your joints and muscles that tells your brain exactly where your body is in space. Walking maintains a baseline, but after 75, the body needs more than maintenance. It needs deliberate, targeted rebuilding. Now, after reviewing hundreds of clinical studies on fall prevention, musculoskeletal rehabilitation, and functional fitness in adults over 70, and drawing on years of orthopedic and wellness practice, I want to walk you through 3 exercises today. 3 specific, medically grounded movements that directly address the gaps walking leaves behind. These exercises require no equipment, no gym membership, no special shoes, just a sturdy chair, a wall nearby for support if you need it, and 5 to 10 minutes of your time. Each of these movements targets something precise, something that walking doesn't reach, and together they form what I consider to be the most important physical habit a person over 75 can build. Exercise number 1, the chair squat. Let me tell you what this movement represents clinically, because it is more significant than most people realize. In geriatric medicine, one of the most reliable predictors of long-term independence is a deceptively simple test. Can you stand up from a low chair without using your hands? That's it, that one ability. And research consistently shows that adults over 70 who cannot do this, or who struggle significantly to do it, are at dramatically higher risk for hospitalization, loss of independence, and fall-related injury within the following 2 years. Why? Because the muscles required to stand up from a chair, primarily the quadriceps at the front of your thighs and the gluteal muscles in your seat, are the exact same muscles required to stand up from a toilet, get out of a car, rise from a bed, climb a step, and recover your balance when you start to tip forward. These muscles are your functional foundation, and after 75, without deliberate exercise to maintain them, they weaken faster than almost any other muscle group in the body. The chair squat does not require you to lower yourself to the floor. It does not require weights or resistance bands. It simply asks you to use one of the most fundamental movement patterns the human body knows, the sit to stand, deliberately, slowly, and with full awareness of the muscles you are activating. Here is how you do it. Choose a sturdy chair. A dining chair is ideal, not a soft couch and not a very high bar stool. Sit toward the front edge of the seat. Your feet should be hip-width apart, flat on the floor. Now lean slightly forward at your hips, not hunched but angled, the way you naturally lean when you are about to stand. Press your weight down through your heels. Squeeze your glutes gently, and push yourself up to a full standing position. Once standing, do not sit back down quickly. This is important. Lower yourself slowly, counting 3 seconds on the way down, and control the descent back into the chair. That slow lowering is called eccentric muscle contraction, and it is often more beneficial for rebuilding muscle strength than the upward phase. Repeat this 10 times. Rest briefly, then do a second set of 10. That is your starting point. 2 sets of 10 chair squats, done slowly and with intention, every day or every other day. If standing is initially difficult, you may use the armrests lightly for the first few repetitions. But work toward completing the movement without hand support as soon as you feel comfortable doing so. That is the goal. That is the functional benchmark we are training toward. Over the coming weeks, you will notice something. Getting up from chairs at home becomes easier. Getting out of the car feels less effortful. Climbing stairs requires less reliance on the handrail. These are not small things. These are the daily measures of your independence. And the chair squat is one of the most direct ways to protect and restore them. Exercise number 2, standing hip circles. Now I want to talk about the hips, because in my experience, this is the most underestimated joint in the body for adults over 75, and the most consequential one for fall prevention. Most people, when they think about fall risk, think about their knees, or their feet, or their balance in general. But orthopedic surgeons and physical therapists who work with older adults will often tell you the same thing. The hips are where the trouble really begins. The hips are responsible for a remarkable range of movement: forward, backward, sideways, and rotational. They stabilize your pelvis when you step. They absorb impact when you walk. They allow you to step sideways to avoid a collision, to recover when you feel yourself tipping to one side, to navigate uneven terrain without losing your center of gravity. And yet, because most daily movement for adults over 75 involves primarily forward motion, walking down a hallway, moving through a kitchen, sitting and standing, the lateral and rotational muscles around the hip are chronically underused. They become tight, they become weak, they lose their responsiveness. And when that happens, the body's ability to catch itself in an unexpected sideways motion is severely compromised. This is where standing hip circles come in. This exercise is simple. It requires no equipment. It takes about 2 minutes, but its effect on hip mobility, hip muscle activation, and pelvic stability is profound. Here is how to perform it. Stand behind a sturdy chair and hold the back of it lightly with both hands. Just for balance, not for support. You should be able to stand independently. The chair is simply there so you do not use mental energy worrying about falling. Stand with your feet hip-width apart. Now shift your weight gently to your right foot. Lift your left knee slightly, just a few inches off the ground. And with that lifted knee, slowly draw a circle in the air. Move the knee outward, then forward, then inward, then back. Make the circle as large as you comfortably can without tilting your torso significantly to the side. 5 circles in this forward direction. Then reverse the motion, drawing the circle in the opposite direction 5 more times. Then lower the foot, shift your weight, and repeat on the right side. That is 1 complete round. 2 rounds per side is an excellent starting point. What you are doing with this movement is activating the deep hip stabilizers, the gluteus medius, the piriformis, the hip external rotators, muscles that most exercise routines ignore entirely. You are also beginning to restore the hip's natural range of motion, which stiffens progressively with age and inactivity. And you are training the small stabilizing muscles of the standing leg, which must work quietly and continuously to keep you balanced while the other leg moves. Many of my patients report that after 2 to 3 weeks of consistent hip circles, they notice a significant difference in how secure they feel when stepping off a curb, stepping over something on the floor, or recovering from a misstep. The hips learn to respond again. And that responsiveness is one of the most important things a body over 75 can develop. Exercise number 3, the single leg stance. If I could give every person over 75 just one exercise, only one, for the rest of their lives, this would be it, the single leg stance. It sounds almost embarrassingly simple. You stand on one leg. That is the exercise. And yet the research around it is frankly remarkable. A study published in the British Journal of Sports Medicine followed a large group of middle-aged and older adults and tested their ability to stand on one leg for 10 seconds without support. Those who could not balance for 10 seconds had an 84% higher risk of dying from any cause over the following 7 years. 84%. That number stopped many cardiologists and geriatricians in their tracks. Because it suggests that single-leg balance is not just a measure of physical fitness. It is a window into the overall functional status of the nervous system, the musculoskeletal system, and the cardiovascular system working together. There is a reason for this. Balancing on one leg requires the integration of 3 separate systems simultaneously. First, your proprioceptive system, the sensors in your ankle, knee, and hip joints that send real-time position information to your brain system, the balance organs in your inner ear, and third, your visual system. When all 3 of these systems are functioning well and communicating with each other efficiently, balance is easy. When any one of them degrades, as all 3 tend to do with aging, balance becomes effortful, slow, and unreliable. The single-leg stance trains all 3 systems at once. It forces your brain to process and respond to balance signals continuously. It strengthens the ankle stabilizers, the peroneal muscles on the outside of the lower leg, the deep hip stabilizers, and the core muscles that run from your hips through your lower back. It is, in short, the closest thing to a complete anti-fall prescription that a single exercise can provide. Here is how to practice it safely. Stand near a wall or behind a sturdy chair. You are not going to grab the wall or the chair unless you feel yourself genuinely losing balance. It is simply there for emergency support, and the proximity of it will allow you to relax and focus on the exercise rather than on fear. Stand with both feet hip-width apart. Shift your weight gently onto your right foot. Now slowly lift your left foot just an inch or 2 off the ground, enough that it is clearly not touching. Hold that position. Breathe normally. Do not hold your breath. Keep your gaze fixed on a single point directly in front of you, a spot on the wall, a piece of furniture, anything stable. That fixed gaze point significantly stabilizes your balance by anchoring your visual system. Hold for 30 seconds. If 30 seconds is too challenging at first, hold for 10. Or for 5. There is no shame in starting where you are. The important thing is that you start. Lower the foot gently, take a breath, and repeat on the other side. Over time, you will feel your balance improving. You will hold the position longer before needing to use the wall. Your ankle will stop wobbling. You will feel more rooted, more stable, more connected to the ground beneath you. And that feeling will begin to translate into everything you do. The way you walk, the way you turn, the way you navigate your home and your world. A note for those of you who are already quite confident with balance: you can progress this exercise gradually. Try closing your eyes briefly for a few seconds of the hold. Try standing on a folded towel rather than a hard floor to introduce a slight surface instability. Try gently turning your head side to side while holding the position. Each progression challenges the nervous system in a new way and accelerates your improvement. But always, always have the wall or chair within reach. Safety is the foundation of everything we do here. Now, I want to speak to you for a moment, not as a physician, but simply as someone who has sat across from enough patients in enough exam rooms to understand something about what it means to grow older in a body that is quietly changing. There is a particular kind of grief that comes with losing physical confidence. It is not like other losses. It is subtle. It does not happen all at once. It happens in small moments. The moment you realize you are holding the railing not out of habit, but out of genuine need. The moment you decide not to go somewhere because the parking lot looked uneven. The moment you ask someone for help with something you used to do without thinking. And each of those moments takes a small piece of something you did not even realize you were carrying. Your sense of yourself as capable, as independent, as someone who moves through the world on your own terms. I tell you this not to be somber, but because I want you to understand what is actually at stake when we talk about these 3 exercises. We are not talking about fitness. We are not talking about looking a certain way or achieving a certain performance. We are talking about your freedom. We are talking about your mornings and your evenings and your ordinary days and the quiet confidence with which you move through them. Chair squats, hip circles, single leg stance. 15 minutes. No gym, no equipment, no special clothing, just you. A chair, a wall, and the decision to begin. Research consistently shows that adults over 75 who engage in regular targeted strength and balance training reduce their fall risk by 30 to 40%. That is not a small number. For every 10 people in this age group who begin this kind of practice, 3 to 4 of them will be spared a fall this year that they would otherwise have had. A fall that could mean a fracture, a hospital stay, a long recovery, a permanent loss of function. 3 to 4 people out of 10. Because of 15 minutes a day, here is what I recommend as your starting routine. In the morning, after you have eaten something and your body is fully awake, find your sturdy chair. Do 2 sets of 10 chair squats, moving slowly, with intention, feeling the muscles engage on the way up and the way down. Then stand behind the chair and do 2 rounds of hip circles on each side. Then step to the side of the chair, keep one hand lightly nearby, and hold a single leg stance for 30 seconds on each foot. That is your routine. It will take you 10 to 15 minutes depending on your pace. Do it every day if you can, every other day at minimum. Track your progress, not obsessively, but meaningfully. Note the date you begin. Write down how many chair squats you can do without stopping, how long you can hold the single leg stance. Check in with yourself every 2 weeks. You will be surprised how quickly the body responds when it is given the right signals. And if you have a physician, a physical therapist, or a specialist you trust, share this with them. Show them this video. Ask them which of these exercises is most appropriate for your specific situation, especially if you have had a recent surgery, a balance disorder, severe osteoporosis, or any condition that affects your lower limbs. These exercises are designed to be safe and accessible, but your individual medical history always matters, and your healthcare team should be part of your wellness decisions. Before we close today, I want to ask you something directly. Which of these 3 exercises feels most important to you right now? Which one do you think your body needs most? Is it the chair squat, because getting up from low chairs or the toilet has become a challenge? Is it the hip circles, because you feel stiff or unstable when you try to move sideways or turn? Is it the single leg stance, because your balance has been feeling less reliable than it used to? Tell me in the comments. Not because I need data, but because I genuinely want to know your experience. This community of viewers, this extraordinary global community of people who show up for their health at every age, is the reason this channel exists. Every comment you leave is a reminder of why this work matters, and you might just say something that helps another viewer recognize themselves and take the first step. If this video gave you something useful, a piece of information you did not have before, a moment of clarity about your body, a starting point you did not know you were looking for, please share it. Share it with someone you love who is in this season of life. Share it with a neighbor, a sibling, a parent. Share it with the friend who keeps saying they should exercise more but does not know where to begin. Because the information in this video is not exclusive. It does not belong to a gym or a pharmaceutical company or a specialist's waiting room. It belongs to everyone. And everyone over 75 deserves to know that their body is not simply declining on a fixed schedule, that there is something specific, something real, something within reach that they can do today. I am Dr. Sophia. This is Wellness by Dr. Sophia, and I will see you in the next video.